Hi everyone, I'm Sohaila Rostami. I'm the director of Rostami Ophthalmic Plastic. I'm an oculoplastic surgeon, and I want to show you how easy it is to use Botox to improve your looks. I have been using Botox for past, I would say, 10 years, 10 or 12 years. And I was in my 30s when I started using it. And the reason I started that young because Botox is for patients in that age category to soften their wrinkles and prevent them to exist. And usually the wrinkles are expressional wrinkles around your forehead, glabellar area, and crow's feet area. And I do have bunny lines, and I do inject in that area as well. So I wanted to show, I haven't injected Botox or Dysport for about 5 to 6 months, and this is the worst look that I have, and I hate myself, by the way. I'm one of those patients that I'm addicted to Botox. Anyway, it took me a while to get myself to this point. So when I smile, you can see the wrinkles on the side of my face, and I can make that bunny line or the wrinkles on my nose. The glabellar area is when I do this. And many people, as they get older, the wrinkle does not open and it becomes permanent, and you have a mad look all the time. The forehead wrinkles are those, like, I have to bring my eyebrow up to be able to see it, but you see sometimes people with these deep wrinkles without bringing their eyebrows up. The crow's feet are these wrinkles on the side of my face. Have these wrinkles without squinting their eyes. It becomes permanent. The bunny lines on my nose is when I do this, and it's a funny face, but I do make those expressions when I'm talking sometimes, and so, or when I go in the sun, and you see these wrinkles here on the side, and there are some people who do have those permanently without making any faces. I also wanted to mention some wrinkles in this area. When I'm talking, if you look, I get some wrinkles in this area as well. And see, so there are areas that you can inject around the lip, and people get those fine lines around their lips. So their lipsticks kind of like goes into those lines. And then you can inject sometimes in these areas that you get those dimpling of the chin. Okay, so I hope these are clear. We will have a videotape in a couple of days after the Botox I've taken, and I will show you those movements again, and you'll see how much Botox or Dysport has made a difference in creating those wrinkles on my face after when I get the injections. I'm not going to show you the injections process, but right after the injection I'll show you the areas for you to see if there is any bruising, any changes, so you feel comfortable if you have ever decided to do Botox in the future. You feel comfortable, not as scared. I wanted to also, the reason I made this videotape, I wanted to tell you that it's really safe. There's very minimal problems with it, and I'm one of those patients that as a patient I've been getting Botox for past 10 years or even longer. So to get rid of some of those fears that some of you may have. Thank you. Hi everyone. I just did the injection, so as you can see my face is a little bit red. I have a little bit of a look, so it's a little bit red if you can see the spots. I just did it like 5 minutes ago, and the Botox or Dysport Botox takes about a week or 5 days to show the effect of it, and Dysport usually takes about 3-4 days, so a little bit faster than Botox. So I will videotape again in a few days to show you the effect of it on my face. Okay? Hi everyone. It's a few days after my Botox injection, Botox Dysport injection, and I wanted to show you how it has affected my face and how it improved my look. So I have to make those expressions that I did for you previously, prior to injection, and then you can compare the before and after, and you be the judge of it. I'm going to try to make the wrinkles in my forehead. So the camera is going to come close to my forehead to show you those wrinkles, okay? So I'm going to try to bring my eyebrow up, and you can see I can move my eyebrow still. Can you see it? But you don't see those vertical or horizontal, sorry, horizontal lines in my forehead. You see that? Okay. Then in the glabellar area, I did some injection as well. So when I frown, my eyebrow still can move, but you cannot see that 11 or the 2 vertical lines in the middle of my forehead anymore. Okay, I never had them, but there are people who actually get those lines because they never get the Botox or the Dysport, and they come in and they have the deep wrinkles formed already, and they want us to take care of it with just the injection of botulinum toxin. I want to explain to you that just when you have those wrinkles without having the expression, it's very difficult to get rid of them by just botulinum toxin. We do have to combine it with a filler to be able to accomplish what you want to achieve by getting completely rid of it. So we do the botulinum toxin first, bring you back in a couple of days, and then inject with fillers. And there are different kind of fillers. Anyway, if you look at my side of my face, so the camera is going to come close to you, and I'm going to try to make squint my eyes. So, and you can see it's very difficult for me to do that. And the same thing with the bunny lines. Remember what we mentioned to you before about my bunny lines, which I don't like. Some people like it and I don't like it. So it's very hard for me to make those wrinkles to happen. You can see that my face is moving, but it doesn't make those kind of wrinkles anymore. Now, some people say that I don't want to get that frozen look with Botox. I really don't think my face is frozen. I still can make the expression. I still, when I smile, you still can see me smiling. But I don't get the crow's feet when I'm smiling. Or, you know, I can show you I'm angry, and you can tell that I'm angry, but it just doesn't have those wrinkles anymore. We just soften it. It just doesn't appear as deep wrinkles as before. So, see, I'm laughing and I have expression. Now, I'm going to show you, we did inject in the periorbital area and the chin area. I don't do my lips, actually. For myself, I only inject in the chin area, and the reason is because if you look at me talking previously and looking at me now talking, I do get these dimpling around my chin area that I don't like, and I try to get rid of it by Botox or Dysport. It's very difficult to inject Dysport and Botox in this area because it really can make your smile crooked and make your mouth crooked. So you cannot get rid of it completely, but it makes it softer and much less noticeable. As I talk, you can see that there are some dimpling is still remaining, but it's not as extensive as it was before. So you can compare before and after, and you can see that I don't have a frozen look. I like my eyebrow a little bit higher. That's very individual. Some people like their eyebrow arched, so we can actually, by injecting different units of Botox in different area of the eyebrow, bring your eyebrow to whatever you like, to shape your eyebrow and actually make it look to your liking. I like my eyebrows higher, level altogether, not arched, as arched as some people like. And I like it. It opens up my eye, and I can place eyeshadow completely the way I like it. And it gets rid of some of the skin that remains behind my eye when I don't have the Botox. So if you compare my picture before and after, you can see the eyebrow is higher on both sides. And even for people who have a droopy eyebrow on one side, we can inject Botox in one side compared to the other side and make him even. So if you have an even eyebrow, we can help you with that. So I hope I answered most of your questions. If you have any questions, please contact us through our website www.beautyforeye.com, or you can call our office 571-203-1300, or you can even send us a message through our Facebook. Thank you so much for paying attention to our presentation.